This is going to be Lab Data Interpretation Hematology Part 2. Hematology is the study of blood and its elements, and for the most part it's automated. Manual cell differentials are done via a microbiologist. So a complete blood count is the first thing we're going to talk about. And hemoglobin is your ability to carry oxygen, and it's located on the red blood cell. And the significance of this test is the amount of hemoglobin in the blood. Normal value in men is 13 to 18 grams per deciliter. Women is 12 to 16 grams per deciliter. High value, or a high amount of hemoglobin, if you have a high level, it is indicative of a history of smoking. You have something called polycythemia, or many red blood cells. A low value means that you're anemic. You may have blood loss or overhydration. And how the overhydration works, the more fluid that we put on board that does not have blood cells in it actually dilutes the sample. Hematocrit, another test, and it is the percentage of red blood cells in the plasma is what this is looking at. Normal value, 37 to 49% of the formed elements should be red blood cells. In women, about 36 to 46%. A high value would mean dehydration, concentrating the sample, or you have polycythemia. This means you probably released EPO, erythropoietin hormone, and made more red blood cells because of hypoxia seen in the kidneys. Low value, overhydration, anemia, or blood loss. White blood cells, significant. A number of white blood cells per cubic millimeter in the blood, and the white blood cells pretty much fight infection. And there are varying forms of white blood cells. They are formed elements, and the white blood cells fight infection. We have neutrophils, which is here. We have eosinophils, and each one of these does a little something different. Basophils, lymphocytes, and then monocytes. And then we have platelets. These are going to help us stop bleeding. These are like emergency patches. And then we have red blood cells in these formed elements. Normal value on white blood cells should be about 4,500 to 1,100 in both male and female. High value would say that you have an infection going, or that you have leukemia, or that you're on steroids of some sort. Low value would be viral infection, or you've had some kind of immunodeficiency of some sort. Red blood cell. Number of red blood cells per cubic millimeter of blood. Normal value is 4.5 to 5.3 million per millimeter cubed. In women, 4.1 to 5.1 million per millimeter cubed. High value, polycythemia, and high altitudes. If you're at high altitudes, like you're a Sherpa, and you stay at high altitudes for a very long time, your body's going to actually develop more red blood cells so that you can carry more oxygen. A low value, bone marrow suppression, or abnormal loss or suppression of erythrocytes. Mean corpuscular volume. Significance is the size of the red blood cell. Normal value in men should be 78 to 100 nanometers cubed. In women, 78 to 102 nanometers cubed. A high value would say folic acid deficiency, or vitamin B12 deficiency, or alcoholism. A low value, iron deficiency anemia, or lead poisoning. This is the cell differential, and just a quick overview of this. All of your formed elements essentially are derived from the same cell. And as they become more specialized under the effects of varying hormones throughout the body, they will either become lymphocytes, monocytes, neutrophils, eosinophils, basophils. This megakaryocyte, through exocytosis, or the release of its cellular material, it'll packet it up, actually gives us platelets. And then erythropoietin hormone, which was here, reticulocyte, and then red blood cell, mature red blood cell. So whenever we speak here in just a few minutes about bands versus segs, a seg is this. right down here, which is a segmented polymorphonucleated white blood cell. Poly means many, nucleus is white blood cell. A band is this guy up here. So if you're seeing an infection to where you have more bands than you do segs, you have more of these than you do of these, then very simply you're putting out very immature white blood cells to fight a battle that they've already killed off the first generation of your mature white blood cells. So it means that your immune system is tasked. Differential, 2 of 7. Bands, the significance of this: percentage of young or immature neutrophils. Normal value should be from about 0 to 5% in males and females. A high value of bands means that you have a bacterial infection. A low value may mean that you have typhoid or tularemia. Percentage of mature neutrophils or polymorphonucleated white blood cells or segmented neutrophils. That's like saying potato, potato. Significance: percentage of segmented or mature neutrophils or white blood cells. Normal value is 45 to 70%. High value means bacterial infection, severe stress. Low value: typhoid, tularemia, brucellosis, cancer, or bone marrow depression. Eosinophils, percentage of eosinophils that are seen. And if we'll go back and take a look, each one of these stain a little differently. Oh, hold on, sorry, I overshot. Basophils are blue, eosinophils are red. These are all white blood cells. So 4 of 7, eosinophils, the percentage of eosinophils, and a normal value should be from about 0 to 3%. A high value would say that you have leukemia or a possible parasite infection. A low value would be from corticosteroid therapy, immunosuppression. Basophils, percentage of basophils, and these are going to be blue. I forgot to point that out. The eosinophils are going to be red. The basophils are going to be blue. Significance: percentage of basophil. Normal value 0 to 3%. High value would say leukemia, and a high value on the basophils is also poorly understood, but we do see a correlation with it in leukemia. A low value, corticosteroid therapy, or they're having an allergic reaction. You've had antigen antibody reaction occur from an allergy source. Lymphocytes. Significance of this is going to be the percentage of the lymphocytes. Normal value should be about 16 to 46%. A high value means viral infection or leukemia. A low value would mean that you have HIV infection or possibly AIDS or some sort of autoimmune disease. Now your lymphocytes are going to also house your T cells. You cannot differentiate a T cell, a T helper. You're just going to be able to differentiate them as lymphocytes whenever you're looking at them on a slide. So if we're seeing a shifting CBC, a complete blood count, if it left shifts, this means that there's a high amount of bands. So you have a bacterial infection that is winning. If you have a right shift, you'll see more lymphocytes. More lymphocytes would say that it is viral in nature. Monocytes. Significance is the percentage of monocytes. Normal value 4 to 11%. High value, if you had a high, if it was over 11%. Tuberculosis, protozoan infections of some sort, or leukemia. A low value, an overwhelming infection, or following the administration of a glucocorticoid. So like say they give you a Medrol loading dose. Reticulocyte count. Significance of this is the measures less mature types of red blood cells, and this is before they're totally mature or an RBC. They're considered an reticulocyte. Normal value 0.5 to 2.5% of the total RBC count, male and female. High value means increased bone marrow or red blood cell production. A low value would say bone marrow red blood cell production is suppressed. erythrocyte sedimentation rate, or a SED rate. Normal value is 0 to 17 millimeters per hour for both men and women. High value, or high sedimentation rate, would say that there's pregnancy, autoimmune disease of some sort, more specifically one that causes inflammation or inflammation. A low value is unknown. We don't know what significance a low value of SED rate causes at this point. Left shift versus right shift. A left shift is an increased amount of white blood cells, segs and bands, and we're going to see a higher amount of bands, and this suggests a bacterial infection. And matter of fact, a bacterial infection that has caused you to bring forth resources that are not mature yet. So a bacterial infection that's winning. Versus a right shift. Increased amount of lymphocytes, and this would suggest a viral infection. Coagulation tests. We have two pathways here that we form actual clots with. We have something called an extrinsic pathway and an intrinsic pathway. And very simply, we can bring about a clot from varying forms, or varying pathways. And if we actually have tissue damage, the tissue damage pathway is considered extrinsic. If we have the platelets that aggregate or stick together, this is called intrinsic. So if I cut myself and I formed a clot and stopped bleeding, the pathway that initiated that would be extrinsic. If I had an occlusion in one of my coronary arteries, the pathway that initiated the platelet plug there would be intrinsic. So both of them, platelets aggregate or stick together, chemicals that activate the common pathway then is formed. You get prothrombin activated. Calcium is very important in this. Once you've activated prothrombin, it converts to thrombin. This is a building block of the actual clot, or what I considered in my previous lectures as a brick. This activates fibrinogen, converts it to form, you get a fibrin polymer that develops, and whenever the fibrinogen activates to fibrin, you can get both the thrombin, fibrinogen to fibrin is here, so you get a thrombofibrin polymer that will essentially be a clot. Now this will form until you remodel that entire cellular area and essentially build new tissue there. Down towards the end of the page here, talking about fibrinolysis, produces plasminogen activator. Once plasminogen is activated, it forms plasmin, and once plasmin is formed, the clot dissolves. Prothrombin time. Significance of this, it measures the effectiveness of Coumadin anticoagulants. Normal values should be from about 11.2 to 13.2 seconds in male and female. High values would say that your prothrombin is not activating, and it's not initiating the clot like it should. Liver cirrhosis might be involved with that. If you don't have enough vitamin K, that's in one of the clotting factors, and several of them actually. Or you have disseminated intravascular coagulation. This is a blood disorder that from an antigen antibody reaction or an autoimmune response, your platelets and your blood clotting factors essentially clump up, and what they do is they not only clog organs that would filter the blood, but they also leave you stripped of any ability to clot. So disseminated intravascular coagulation, very sick patient. Treatment on this is going to be the initiation of vitamin K. A PTT, or a partial thromboplastin time. Significance: detects coagulation disorders in the intrinsic. Now that's going to be through the platelet pathway of the coagulation cascade. Normal value is going to be 22.1 to 34.1 seconds, male and female. A high value would say that we have way too much heparin on board. So a PTT that's high would say we probably need to back off on the heparin therapy. Low values are not clinically significant. Treatment: decrease heparin dose. Protamine, which is the antidote for heparin, or initiating them and giving them some fresh frozen plasma, which essentially has not only the plasma in it, but it also has clotting factors and all of the proteins that would be inside of the plasma from the multiple donors. International Normalized Ratio, or the INR. This reports the PT in a standardized form, and it compares it against the control. Healthy patients not receiving anticoagulants should have an INR of 1, meaning that it came out equal to the control. Patients receiving warfarin therapy, INR should be between 1.5 and 2.5, which means 1.5 to 2 times the control. INR is an easy way of standardizing. If you got an INR reading in one hospital, it'll be the same in another. However, some of the tests that we see, the reference labs and the reference lab values are different. So a PT-PTT ratio or a PT-PTT value may be different from one hospital to the next, depending on their lab value reference. Always look at the reference that is on the lab slip. If it says high, then please adjust accordingly, because that was high per their lab reference. A D-dimer. Degradation products and cross-link fibrin. D-dimer pretty much allows us to see if the person has the ability to form free-floating thrombosis, used to diagnose abrupto placentae, disseminated intravascular coagulation, deep vein thrombosis, and pulmonary embolisms. This brings us to the end of part 2. If you have any questions over the following subjects, please give me a call. My name is Roy Smith. I can be reached at roy.smith@redlandcc.edu or smithr@imso.net. Thank you.